everybody, welcome to my channel Magic with Food. Today in this video we are going to discuss on antenatal care and a diet plan for a pregnant lady. Let's welcome Dr. Nalini on the show.
This is Dr. Y. Nalini Devi, gynecologist and obstetrician. A woman is very fortunate to become pregnant and go through motherhood. A woman goes through 280 days of gestation. That is, her pregnancy period is about 280 days from her last menstrual period. For all practical purposes, we talk in terms of weeks, that is, she carries her gestation for 40 weeks. And for further clarification, we divide it into first trimester, second trimester, and third trimester. First trimester consisting of 12 weeks, second one up to 28 weeks, and 28 to 40 weeks is third trimester. A woman needs to be physically fit and emotionally sound to go through her pregnancy. She should be committed totally. This is because she is bearing a fetus within herself. Now, it is not only her responsibility, but it is also the whole family should be committed to make her feel good, and at the same time be emotionally sound. They need to protect her in all ways, take care of her at every moment. Now, during her pregnancy, what the woman has to take care is she needs to go to an obstetrician regularly, and when all she is expected to go, she should call on her obstetrician. So, for all practical purposes, she needs to go every 4 weeks up till 28 weeks, and every 2 weeks from 28 to 36 weeks, and every week later up till 40 weeks until her confinement is over. That is, until she delivers. Now, regarding the immunization, she should be prevented from certain diseases during her pregnancy and after the delivery also. She needs to get immunized with the tetanus toxoid, that is 0.5 ml at 20 weeks of gestation, and second dose 0.5 ml after 4 weeks of gestation. She needs to go through 2 mandatory scans, that is one nuchal translucent NT scan at 12 weeks and a TIFA scan, that is targeted imaging for fetal anomalies at 20 weeks, to make sure that there are no anomalies. Now, with so much of advancement, the anomalies are being detected very early, and the woman should be given the privilege to detect it early and get terminated if there are any anomalies which are incorrectable. A woman needs to enjoy her pregnancy throughout. This can be only be done by proper comfort that is given from the family and the obstetrician. Once she goes for regular checkups, everything will be met. She needs extra iron, extra calcium, extra vitamins. She needs about 1200 kilocalories than her base level during her pregnancy and 1600 kilocalories during lactation. This all can be met by a good and nutritive and proper diet. And there are certain things, the position and all. In the second half of the cycle, she needs to lie down on her left side, prevent right side posture to prevent postural hypotension. Do's and don'ts in the pregnancy, what a woman is expected to know. So, during her pregnancy, she needs to have good diet. That is, throughout her pregnancy, she should make sure that she keeps aside 500 ml of milk to meet her calcium demands. She should take in the form of milk or in the form of curd or any other form. Then she needs to take good breakfast, lunch and dinner consisting of high protein, and in between she needs to take fresh fruits and fresh fruit juices which will meet her trace elements and other vitamins demand. Not only the nutrition, it is also the rest which is equally important. That is, she needs to rest for 2 hours in the afternoon and 8 hours compulsorily in the night, and the fetus grows during this period. With nutrition and rest, it is equally important that she goes through exercises. Throughout the pregnancy, we advise non-bearing exercises, that is, walking. At the same time, first trimester, she can go for yoga or swimming exercises. This is all should be done with an obstetrician's consent. Now, during her whole pregnancy, she needs to wear good washed clothes, loose leg wear slippers. She's not supposed to go to any hillocks or mountains, high altitudes. Whenever she wants to travel, she needs to take the consent of the obstetrician. It is always better she travels by a train in the lying down position. Now, travel and all should be advised by the obstetrician. Regarding the first trimester, she needs to take rest. She may tend to have more vomitings. This is because the fetus is being formed during that time. She needs to take good rest, no coitus, and good sleep. And if she has excess vomitings, she should consult her obstetrician. First trimester, she may lose 1 or 2 kgs weight, but she need not be perturbed. The acceleration of the weight is in the second and further acceleration in the third trimester. A woman tends to gain 8 to 11 kgs during her pregnancy, out of which 2/3 is maternal, that is the mother herself, and 1/3 is the fetus. The diet should be supplemented by extra iron from 20 weeks onwards up till 40 weeks to meet the demand from the fetus. This can be done by the diet also, but to make sure that if she has any excess bleeding during her labor, this will help her by taking prophylactic iron therapy. At the same time, she needs about 500 to 1000 milligrams of calcium per day, which can be got from the diet. And not only that, she should be supplemented, and this extra calcium also helps in prevention of certain complications like pregnancy-induced hypertension.
For such a beautiful creation, the pregnant lady should always take a balanced diet with some increased nutrients. Let's look into the nutrients what are to be increased to have a healthy child. Energy needs during pregnancy. In the first trimester of the pregnancy, they do not need extra calories because of morning sickness. In the second trimester, extra 300 calories per day are needed. In the last trimester, 450 calories per day are needed. All the extra calories needed are used first during lactation and to withstand the hormonal changes, to withstand the physiological changes and the biochemical changes occurring in the body during pregnancy. Protein needs during pregnancy. Protein needs are increased by 15 grams per day during second trimester and third trimester. Extra proteins needed are used for the development of fetus. Usually, extra proteins are provided so that proteins are not used for energy. These can be obtained from legumes, milk and milk products, seafoods, lean meat, eggs, peas, and nuts and seeds. Vitamins and minerals play a key role in supporting baby's growth and development during pregnancy. The main vitamins and minerals to be included are folic acid 600 micrograms, iron 10 milligrams, calcium 600 milligrams. Along with it, vitamin D DHA, which is an omega-3 fatty acid, plays a vital role in babies' brain and eye development. Iodine and zinc is also necessary for fetal development. Folic acid, which is a B vitamin that may help to prevent certain birth defects. During pregnancy, a woman needs 600 micrograms of folic acid per day. It is hard to get this amount from foods alone, so it has to be supplemented. Natural food sources of folate include legumes, green leafy vegetables, and citrus fruits. Iron is an essential nutrient during pregnancy because the blood volume is increased. It is more during third trimester. Low levels of iron leads to low birth weight babies and cause iron deficiency in the mother. During pregnancy, 600 milligrams per day of calcium should be included. It helps to build up the bones and teeth of the baby. Calcium, along with vitamin D, helps in heart, nerves, and muscle development. Iodine, zinc, phosphorus, magnesium, choline, and other B complex vitamins play a vital role in the fetal development and also prevent developmental abnormalities of the brain and spinal cord. Hydration of body during pregnancy is essential. Intake of 3 liters of water is advisable. Increased intake of water is essential because blood volume increases by 45%. Hydration helps to pump the nutrients to the fetus, relieves constipation, reduces the risk of urinary tract infection. Dehydration during pregnancy leads to headache, tiredness, anxiety, mood swings, and there is also a risk of early labor.
Further, there are certain diseases, that is metabolic disorders pertaining to pregnancy, which a woman needs to be careful about. That is gestational diabetes, that is diabetes complicating pregnancy. This diabetes, it is due to hyperinsulinemia and insulin resistance that occurs during pregnancy, mainly due to the hormones that are produced in the placenta. So this is restricted to pregnancy, and the woman gets free of this diabetes after her delivery. Some of them land up in type 2 diabetes later in life, but presently they have to be very careful about this gestational diabetes because it has morbidity on the mother and fetus. At the same time, there is another disorder, that is pregnancy-induced hypertension, which is also due to the hormones that are produced in the placenta. Otherwise, the placenta is the reason for pregnancy-induced hypertension, which occurs after 24 weeks of gestation. With this hypertension, the woman tends to have proteinuria, hypertension, and edema. Or this is one condition which causes morbidity and mortality to the woman. These conditions can be prevented or treated effectively by regular antenatal checkups. That is, once a woman goes regularly to the doctor, she can be detected as early as possible and treated properly. She will be free of these complications. Rest, exercise, and regular antenatal checkups will definitely give an intact mother and a good fetus at the time of delivery. Thank you.